Hello, everyone. My name is Jeffrey Walton. I'm editor-in-chief of Chain Drug Review and Mass Market Retailers. Welcome to our video forum. We're thrilled today to have as our guest John Standley, president of Walgreens. John, welcome.
Thank you. Thanks for having me. Appreciate it, Jeff.
Before joining Walgreens last August, you were a competitor for many years. Maybe you can talk a little bit about how your view of Walgreens perhaps has changed or been confirmed during the last 6 or 7 months.
Thanks, Jeff. Yeah, it's been a very exciting and fun and challenging 6 months since I joined Walgreens. And I came to Walgreens, for a couple of reasons. One, I'm a big believer in the community pharmacy model and in retail pharmacy, and I think we can, as community pharmacies, have a huge impact on the communities that we serve. So that was one big driver for me. For Walgreens in particular, though, just such a iconic and amazing brand, so well established and known, across the country. An amazing network of stores, of locations to really deliver community care, with 25,000 pharmacists deployed across the nation. And of course, I had the chance to really get to know the senior management team through the various transactions that I did in my prior life. Mm-hmm. So in that regard, I kind of felt like, I knew what I was getting into in terms of, the industry and the opportunity when I joined the team. Since I've been here, I think, in terms of things that maybe surprised me a little bit, was really the level of transformation and change that is going on inside the company. Mm-hmm. Really, we think about COVID-19 and the impact on the communities that we serve. We think about, how even before COVID-19, came about, how consumer and patient behavior was changing. And then you add those things on top and, it's been pretty amazing to see how Walgreens is really pushing to, evolve its business model and change to adapt to the changing needs of our customers and patients. So just the level of activity going on is really quite impressive. And really, across many different, aspects of the business. First was really just, addressing COVID and trying to take, great care of team members and keep them safe, while still providing, the necessary goods, services, and prescriptions that our customers and patients need. From an education standpoint, just trying to educate the communities that Walgreens serves, about, how to be safe and what we can do to navigate our way, through the pandemic. Mm-hmm. And so I'm just really proud of all of the work that's gone on, here at Walgreens to tackle the situation and really push forward to drive, outcomes and change as we're working through the pandemic. Because it's created a great chance to really get down, several levels in the organization since I've been here, and it's been just really impressed mm-hmm. with the strength of the team here. Mm-hmm. So I knew, very senior level management, Stefano and Alec and Ornella and whatnot before I got here. Mm-hmm. But the chance to really kind of jump in and work with all the different teams inside the organization as they've worked their way through this transformation and change mm-hmm. Has been really fantastic.
Roz Brewer has just joined Walgreens Boots Alliance as CEO. What can you tell us about her?
She brings a ton of, obviously, retail experience. Mm-hmm. She brings some great, digital experience and background. She's got, experience, I think, in business transformation. She mm-hmm. tackles, many of the same issues that we're working through here mm-hmm. At Starbucks. And she led, I think, some very significant change at Walmart, in terms of how they operated their business. Mm-hmm. So I think she's, got a great skill set and mm-hmm. background to kind of jump in here and help us push forward on our mm-hmm. journey. So I'm really excited to get the chance to work with her.
Mm-hmm. You mentioned that COVID has been the overriding concern for Walgreens and the whole country. Maybe you could talk a little bit about Walgreens, the extent of Walgreens' efforts in testing and immunization.
Yeah, it's interesting. I really think, community pharmacy has really probably changed forever after this. I think there's a much better understanding today, both amongst our partners, payer partners, but also just generally in the United States about the value of community pharmacy and the role that it plays.
Mhm.
And I think it's just never been more apparent than what we've been able to do. Again, having critical medications, our push on, flu vaccination and efforts, which I think has had a huge impact on controlling this pandemic to the extent it can be controlled, because we've kept a tremendous number of people out of doctors' offices and emergency rooms, which has really helped, I think, prevent the spread, but also keep people who could have become vulnerable through the flu from, getting vulnerable and getting COVID. So I think it had a huge impact there. But just again, essential medicines and services and information. So, I think community pharmacies played a huge role. Then you sort of start to think about, testing, which really kind of evolved first as COVID spread. And Walgreens was, I think, an early player in the space and has really evolved. We've evolved our model and expanded it quite a bit over the last several months. We're now have done over 5 million tests, and we've expanded our footprint. We're headed towards 5,000 locations where we'll be doing testing, and we have very significant capacity today. We can do 100,000 tests a day with the capacity we've now built. And I think testing will just, remain really important, even as we get through the vaccination effort. Testing will still play a key role in keeping people safe. And I think the testing model, as we've seen in certain states already, the testing model can evolve to a test and treat model too, for certain acute opportunities. So I think you'll see, a good evolution of the business model in pharmacy around the other services that we can provide. And I think testing's, a great example of that. The vaccination effort is really something pretty amazing, I think. And it just highlighted how important community pharmacy is. And I think what Walgreens has done here, particularly around this long-term care facility effort, is had a huge impact on the outcome of this pandemic. I mean, when you look at the way death rates are coming down in long-term care facilities, it's really quite incredible. And so I think the effort by the Walgreens team to really stand that program up, something Operation Warp Speed and the former administration approached us about. I think others were approached and chose not to do it, but we thought it was something that was critical to helping this country get through the pandemic. So we leaned in a very big way. We stood up a program that was incredibly complex to get done. When you look at all the aspects of it, from the logistics model we had to build to handle, vaccines, which are not simple to handle, to the coordination with the long-term care facilities and how we put that whole program together, to the training and development of our team members to deliver it and to match them up with the availability of the patients at the facility and the vaccine arrival and the team arrival and really deliver that. It was really, I think, quite an undertaking, and I'm really pleased with the way the Walgreens team has delivered that program. It's had a huge impact on this thing. It's also given us a new muscle. When we think about where we go from here with our vaccination efforts, we've always done offsite flu clinics, and so we had experience from that, but this was really much more complex, and I think we can now, handle in a really good way, or deliver, care outside of our box in a new fashion that we really couldn't do before. So I'm excited to see where in the future we can really take that skill set. So it continues to evolve the pharmacy model and what we can become. And then, we now can take that skill set and that muscle and start to use it to address vaccine equity, which is, I think, is a real need that our nation has right now. So now we have this capability to go offsite and vaccinate and handle the scheduling and the logistics and whatnot to really deliver that. And so I think we have the opportunity to really now get into communities that maybe don't have access to a convenient location for vaccination, or where it's difficult to schedule, or where transportation's an issue, and really deliver for those communities. And so I'm excited to see us kind of, bring that effort to life. The administration has now sort of pointed out too that teachers, need to be prioritized. And so that's another way where we can use this offsite clinic capability to also tackle that need as well.
Mhm.
So it really is, manifesting itself in several ways, and vaccine equity, has helped us really kind of get to one of our core values, which is really, delivering healthcare and addressing the needs of the communities that we serve.
Mhm.
So now we have the opportunity through offsite clinics, through things that we can do in store to assist, as well as, through partnerships like we've done with Uber to
Mhm.
break down barriers, both around education, which I think is critical. We really have to tackle vaccine equity, which is going to be a critical component in communities that have concerns about it, but just generally, I think it's going to be something that we're going to have to work through. And Uber has agreed to partner with us on both the education aspect, but also through breaking down the transportation barrier,
Mhm.
which I think is going to be important for a lot of folks.
Yeah.
So you can see how it's having a real tremendous impact on our care model and about the way we think about the communities that we serve and
Mhm.
how we're bringing that care to life. So it's pretty impactful, I
Yeah.
think, in terms of where we're going.
WBA has accelerated its investment in VillageMD and plans to have 600 to 700 clinics open in its stores within the next 4 years. What will that mean for the Walgreens customer, and what will it mean for the business?
Yeah, again, it goes right back to our core values and delivering healthcare in the communities that we serve. It obviously changes the experience just in the physical box that we put a Village MD into by offering primary care with pharmacy in the same in the co-location. So it's an evolving care model, and I think a couple of things start to happen when we do that. And I have to tell you that Walgreens has experimented over the years, and maybe that's not a great word, experiment, but has really worked on several different kind of care models with convenient care and acute care and different things inside the box. And I think where it's kind of come out when I look at some of the findings from that work is that primary care is really a great fit.
Mhm.
It's a great fit because the same types of patients that frequent the pharmacy, chronic patients, polychronic patients that use a lot of prescriptions, are also the same patients that are, frequent primary care. And so it's a much better fit with our model and allows us to really link up those care models together to coordinate care between the primary care physician, who really is the overall manager of a patient's care, with, the pharmacist and the team that we have in store, and all the different tools we're building around them from the omnichannel experience to really bring that to bear
Mhm.
in a coordinated way from a care model perspective. And with the co-location, it also allows us to expand the scope of practice in terms of what a pharmacist and the team can do
Mhm.
for those patients. So I see it as really a big driver of change, not only in the 600 locations where we'll have Village MDs, but really across the whole business model, because it really gives us a showcase to show what we can do in terms of driving outcomes and better care that we can then leverage further in our business model.
Mhm. Are you optimistic that with these sort of developments, the shift toward payment for outcomes will happen sooner than we perhaps previously thought?
Yeah, it's a great question. I feel like it's been 20 years in the pharmacy industry working on that one.
Mhm.
And, I do think we're getting to an inflection point where things are changing, where, again, the view of pharmacy and community care is changing, where there's a recognition that local healthcare is critical
Mhm.
to delivering a great healthcare experience.
Mhm.
And that's creating an opportunity, I think, for us to play a different role as
Mhm.
we think forward about how healthcare will be delivered.
Mhm.
So I think it's a really exciting time.
Mhm.
It's a really transformational time. It's not going to be easy.
Mhm.
There's going to be plenty of challenges along the way, but I really do think we're well positioned to have a much bigger impact on healthcare
Mhm.
than the opportunities that we've been given in the past.
Mhm. I remember when you were NACDS chairman, you had the great line, "No outcomes, no income."
Yeah.
So,
And still very true.
yeah,
Still very true. And I think, it's not just about adherence. Adherence is critical, and it's, one of the core things that we can do, but there's so much more to it. And
Mhm.
there's so much more impact that we can have. And things like VillageMD really create those opportunities for us to bring those kind of care models to life.
Mhm.
Yeah.
Let me shift gears because, as you say, there's a lot of activity going on at Walgreens these days. Recently, you rolled out your revamped loyalty plan. Maybe you can talk about how the My Walgreens offer is different from what preceded it.
Yeah, I think that it's a great question, and we're really excited to roll it out. We've already surpassed 46 million new members just since we launched it in the fall. So
Mhm.
the uptake has been fast,
Mhm.
which is great. It's a great program. On its surface, it's a value program, so it encourages enrollment and participation as it brings value, to our customers and patients. But what it's really about is what's underneath it. And what's different about it is really the customer engagement platform that it's built on.
Mhm.
So it really allows us, and this is, I think, important for us in terms of where we're going. It really allows us to bring a much more personalized experience and build a deeper personal relationship with our customer and patients
Mhm.
as the program evolves and develops. And that's really where we're going.
Mhm.
And so when you think about, the front of store experience and the kind of information that you work with your customers and how you interact, and learn and develop that relationship. And then you start to think about, the pharmacy and the patients there and how you work with those patients and the learnings that you have and how that can sort of come together in the experience. That's really kind of where we're going.
Mhm. Mhm. The personalization that you're talking about obviously leads into the whole technology realm. Maybe you can
Absolutely.
talk
Yeah.
about some of the investments you guys are making in technology and how that will strengthen the whole omni-channel offer of Walgreens.
Long before I showed up, the company really, dedicated itself to transformation and established transformation and digital transformation as one of its core values. And it's made significant investments to, upgrade systems and develop new technologies, as well as really harness in a more productive way all the data that lies inside the company.
Mhm.
And so that investment is really now starting to manifest itself in the business with things like My Walgreens, and in terms of new technologies that we're building in the pharmacy.
Mhm.
And so, for me, I'm kind of lucky, honestly, to have the opportunity to come in here with all of the kind of hard work and investments to leverage to
Mhm.
now kind of bring to bear on the business to transform it. So it's actually a pretty exciting time to be here as those things start to come to life and we can start to use those new tools to create better, experiences for our customers and patients. And
Mhm.
so it's technology that, it's investments in technology that allow us to drive that personalization, the engagement platform, the machine learning, the data science that's kind of behind it. It's technology that's allowing us to really develop and advance our pharmacy capabilities.
Mhm.
And then the end, as you said, it's about how we bring all of that together in
Mhm.
some unique, customer journeys that really help our customers on their wellness journeys, right?
Mhm.
That's really what we're up to.
What does the entrance of Amazon into the prescription drug business meant, or will it mean for Walgreens and other traditional pharmacy operators?
Yeah, it's a great question. It's something, obviously it's top of mind, for us and for the industry and investors and everyone, are kind of trying to figure it out.
Mhm.
And in the short, the answer is it depends on where they go with it and what they do.
Mhm.
When we think about just what's happening right now with vaccination, testing, just as two examples, but also the interaction that we can create in the store and how community pharmacy is embedded in the communities that we serve,
Mhm.
you know, that differentiates us. It
Mhm.
differentiates us from mail order, which PBMs have. I think it differentiates us from, the experience that Amazon can deliver today for sure.
Mhm.
And so that's really where we're going to, drive our differentiation is really our omni-channel experience will include, the things that we can do digitally, but
Mhm.
also that network of, 9,000 plus locations and 25,000 pharmacists and what they can bring to bear on
Mhm.
healthcare.
Mhm.
And that's really how, however Amazon comes to market and the things they do, I'm sure they'll be successful and drive change, but that's how we'll be different.
Mhm. Um, Let me ask you about your front end business. I mean, obviously
Yeah,
that's been impacted greatly by the
it
COVID
has.
situation as well.
Yeah.
Maybe
Yeah.
you could talk a little bit about that.
Yeah, it has, and it's a great question, and it's COVID. It's the way COVID has impacted behavior, and it's really the way the consumer was changing before really COVID even hit. With e-commerce and online businesses really growing quite rapidly in some of our core businesses.
Mhm.
So we've really, again, part of that investment in technology has really allowed us to make our business much more convenient, from our, growing e-commerce business to how convenient we are, for curbside pickup in
Mhm.
30 minutes or less with our pickup offering,
Mhm.
and our home delivery business,
Mhm.
all of which have adapted, to the changing consumer behaviors. A lot of that behavior will stick.
Mhm.
Some people, I think more people will come back to store, but there's always going to be now a core group of customers, I think, whose behavior is changed. And now I think we have a much more convenient offering, so we have 9,000 plus convenient locations, but now how you interact with those locations is even more convenient.
Mhm.
And that gives us 9,000 distribution points from a home delivery perspective. But
Mhm.
it's also a unique model that allows us to have, probably speedier home delivery over time, and again, convenient pickup points, and still accessible, very conveniently to come in store or to pharmacy.
Mhm.
So I think drive-through has
Mhm.
changed quite a bit as well. We can
Mhm.
now do COVID testing in the drive-through.
Mhm.
You can pick up front-end purchases through the drive-through. You can put pharmacy and front-end, purchases together for pickup or
Mhm.
delivery. So really, it's the business model has evolved quite rapidly.
Mhm.
And so you see that, again, the technology investments, the behavior change, all of it, we're adapting to in a very rapid way. We've done a
Any
great job. Yeah.
any thoughts on how the physical store and what goes on in the store may change as a result of all these factors you've just been talking about?
Well, there's a lot of things happening. I mean, VillageMD is a great example, coming in store. We have other partners that we're working with to drive health outcomes. So we have health corners
Mhm.
that we've been talking about that are going into stores.
Mhm.
We've got lab partnership, with LabCorp in store. So I think you do see that the healthcare offering is expanding inside the box, which is
Mhm.
changing, that experience in the box. We've
Mhm.
got a great partnership working, with Kroger in a couple of markets that's, kind of showing how the front of the store can adapt and change, in terms of what we can do even with food.
Mhm.
And I'm, from my past, I'm excited about how food and healthcare kind of fit together,
Mhm.
and the things that we can do there. And so I think you'll see some more from that, from us over time as well.
Mhm. You mentioned partnerships. I assume that will remain a cornerstone of Walgreens' strategy going forward.
Absolutely, absolutely.
Mhm.
We, largely run an open platform, so we're excited to partner, with others to drive change, to
And I
drive care.
guess the open platform is also an advantage potentially in the PBM market as well, yes?
Yeah, I mean, I'd say agnostic. We value the partnerships that we have, but
Mhm.
it is an open platform.
Mhm.
So,
Mhm.
and that does differentiate us in the marketplace today.
John, it's been great talking with you. Appreciate you sharing your insights with us.
My pleasure. Thank you so much for inviting me, and it was good to catch up and talk a little bit about the exciting things we have going on.
Absolutely. Thank you.